The African Population and Health Research Center, abbreviated as APHRC, is the continent's premier research and policy organization exploring population, health, and well-being questions. APHRC is a proudly Africa-based, African-led institution headquartered in Nairobi, Kenya, with a West Africa regional office in Dakar, Senegal.
APHRC started because a group of people realized that there was an absence of African voices when it came to discussions that affected the African continent. So these individuals felt that we needed an institution that would sort of nurture African experts so that we can start hearing more Africans contributing to issues that affect the African continent.
At APHRC, we are dedicated to transforming lives through generating evidence that drives policy action, ultimately improving the health and well-being of the African people.
APHRC works in 3 core program areas: research, capacity strengthening, policy engagement, and communication.
For the last 20 years, APHRC has been at the forefront of groundbreaking research in sub-Saharan Africa. The center's research priorities are organized within 4 integrated work themes: human development, health and well-being, population dynamics and urbanization in Africa, and the data science program.
Within those 4 themes, we have different research areas that we focus on. But broadly speaking, it's work that leads to population research and education research.
Currently, the center is implementing over 100 projects in 35 African countries.
The center is within Africa and comprises mostly of Africans. But it is not limited in thought, in ideas, and in research to Africa. It has a vibrant interaction with different and various institutions across the world. Hence, the support for the center comes from everywhere in the world that you can imagine. And that support is based on the confidence and the trust that they have both in the leadership of the center and in the outcomes that the center has produced consistently.
We collaborate with different partners depending on what we're trying to implement. So in research, we use collaborators such as universities, partners who we have trained within our capacity strengthening, and governments and regional bodies.
APHRC is leading work on promoting positive early learning outcomes by researching the power of learning through play. The research is being carried out in 3 counties in Kenya: Kajiado, Kiambu, and Nairobi, and in Nigeria and Gambia. APHRC researchers engage with ministries of education and with the directors of early learning programs, teachers, parents, and communities. This is part of the Knowledge and Innovation Exchange of the Global Partnership for Education and will influence the scaling of early learning through play initiatives on the continent.
APHRC engages with policymakers to inform action and influence policy decisions on health and development. We contribute to developing effective public policies, efficient implementation of services, and joint learning on interventions. We believe that Africa and African-generated evidence must be at the forefront of decisions supporting improved growth and development in the region.
We transform lives in Africa through research, and for that to happen, that research has to be done and available out there. So we publish whatever we do, and it's accessible to people globally, and it's able to inform their action.
Our biggest asset is our people, who include dedicated researchers and experts working tirelessly to achieve our mission. At APHRC, we are dedicated to fostering a healthy workplace for our employees and encouraging work-life balance. The APHRC board and leadership team also provide critical support to drive our work across the continent.
I had the honor to be the first chair of the independent APHRC. And as I look back on my life, I regard APHRC as one of the greatest achievements of my own professional life. And I am filled with not just pride, but also joy at how successful the center has proven itself to be and how much good it is still doing in the world.
APHRC has a wide range of stakeholders, including our funders, who share in our vision and give meaning to our work. We actively collaborate with governments, academia, non-governmental organizations, civil society, communities, and the media to ensure that the policies formulated are not only evidence-based, but are tailored to the unique needs of the African context. The Center's partnership extends globally, allowing us to share our insights and learn from others, fostering a dynamic exchange of ideas.
APHRC very early on recognized the importance of strong systems, and I would say the importance of integrity, because funding that comes from either foundations or government agencies from other parts of the world, if somebody gives you money, they want to be sure that the money is going to be used well. And if the money is used well, then of course they are more comfortable giving you more funding.
We occupy a quite competitive environment. The NGOs have to compete for the same funding, for funding from the same donors. So APHRC has had to be up to the game, being relevant to the challenges that are facing Africa. What APHRC has done is to get into that space of being able to generate our own funding. And one of the things we've done is we have extra space, premises that we're able to rent out and make some extra income. Also the training facility that we have has also helped us in terms of generating additional funding to make us self-sustainable.
At the heart of all development issues, including health, education, population, and urbanization, lies the fundamental human right of gender equity. APHRC has over time developed transparent policies to advance gender equality and equity across all levels of the organization, including decision-making. We continuously strengthen our policies to be gender responsive and encourage initiatives to promote diversity, inclusion, and equity. APHRC milestones over the last 20 years are numerous and include global recognition and awards.
Et c'est avec plaisir que qu'on est là et qu'on constitue un peu, n'est-ce pas, qu'on essaie de s'étendre dans la sous-région et qu'on essaie de travailler avec, disons, les universitaires et les autres chercheurs qui sont dans la sous-région. Donc, vraiment, c'est ce que je retiens de Waro et de la collaboration, mais aussi de l'excellent environnement de travail avec les chercheurs, des amis, des collègues qui sont vraiment d'une générosité extraordinaire et qui nous appuient, qui m'appuient vraiment dans la mise en œuvre de Waro.
As for APHRC's future, this relies on the excellent foundation already built, including our robust systems, our empowered team, and the networks made over the years. Our current impact-focused 2022-2026 strategic plan reinforces our commitment to playing an instrumental role in shaping the continent's future. Bold and ambitious, the new strategic plan redefines the center's role as a catalyst and enabler in the African research and development ecosystem.
The solutions to Africa's problems sits with us here in Africa. But the way research is funded oftentimes does not allow researchers on the continent to ask the types of questions that need to be answered in order to move us forward. And so local investment in research is so critical, and we really cannot move forward to that. So African governments, we need to recognize that that's where the future growth of the continent lies, is in innovation, in research. We call it a global knowledge economy, and we cannot compete in that space without making the investments that are necessary to harness that human capital and potential that we have on the continent.
Thank you for supporting the African Population and Health Research Center over the last 20 years. Join us in driving change through research to transform the lives of the African people.